Okay. Okay. Dear member organizations, welcome to the first IFMSA programs webinar to take place on the 28th of December 2015. I'm here with several members of the team of officials who are here to present you with very important information on programs that all of you will need in the future work that we are going to do together on programs. So I would just like to shortly present the people who are here with us. We have Jozo Schmut, the scope director. We have Carles Pericas, the SCORA director. We have Skander Esafi, the liaison officer to public health issues. And we have Marie Hauslev, the liaison officer to the WHO. I would also like to thank the people who contributed to the organization of this webinar, who include a number of program coordinators, including Ahmed Taha, Beatriz Blanco, Hanna Luchev, Sirin Sabila, and Victoria Berkist. And finally, but not least, I would like to thank the Vice President for Public Relations and Communication, who is also helping us with the technical part of the webinar. And finally, I am Petr Velikov, the Vice President for Activities of IFMSA. I would shortly like to present to you the people who are currently in charge of coordinating the IFMSA programs. Those, you can currently see them on the screen. I would like to mention that all of the information that you're currently seeing is going to be shared with all of you after the webinar. Therefore, you're going to have access to it. Before we proceed, I would like to explain a little bit about our terminology in order to make sure that we are all on the same page. So first of all, we are IFMSA, the International Federation of Medical Students Association. So this is one of the most frequently used abbreviations in IFMSA. Next, all of you are members of our national member organizations. The term NMO is frequently used to indicate any organization which is a member of IFMSA. Next is the word activity. When we say an activity, this means any type of project, any type of conference, any type of activity that you are organizing in your local committee or your national member organization. However, in order to unite all the things that you're doing in your local committee and national organization, we're using the general term called activity. The person who is taking care of that activity is called the activity or project coordinator. Both of those terms are going to be used widely in this webinar. Now I'm going to give the word to our scope director, who is going to present you with the background on programs.
Well, I was expecting a clap. So hi, so hi, I'm Jozo Schmuch. It's a very hard surname to pronounce, so don't blame Peter. It's terrible. It's German, horrific. In any case, I've been assigned to give you a background on IFMSA program, which is sort of appropriate because I love history. So I'll give you the history of IFMSA programs, and it's basically what IFMSA programs are. And how we came up with the idea of programs, but also what what our program coordinators do, and more. So we should start, shouldn't we? We could have the next slide. Okay, so the general overview of IFMSA program and what IFMSA programs are is they are centralized stream of activities which are organized by IFMSA National Member Organization and IFMSA internationally. It's very complicated, like a long sentence, but it's actually very simple. A couple of years ago, we had a very big problem with transnational projects. We had many NMOs participating in internationally coordinated activities, and we never could have assessed the impact that those activities actually had on our fields of work. Basically, then, during the reform of IFMSA, which I won't go into many details, we decided to switch from transnational projects to programs. Programs, they centralize all the activities that we do locally, nationally, or even internationally, and put them towards a common goal. What does that mean, actually? It means that even if you have a project in, let's say, China, and if I have a project in Denmark, they will actually, and if they are in the same field, they will be directed toward a common goal. Sorry. Okay, sorry. Whenever we have technical issue, it's my fault because I'm terrible with technology. In any case, programs are led by program coordinators who are actually, okay, programs are led by program coordinators who are appointed by the IFMSA Executive Board, but I'll go into more details back when we discuss the program coordinators themselves. So going back to how we centralize the activities, basically it means that, let's take mental health, for example. If we have an activity in Australia that deals with advocacy for better mental health care, and if we have something in Italy that deals with raising awareness in community about mental health issues or mental health as such, they will be in the same program, and those activities will be directed toward a common goal, which is the end goal of the program. I will have the next slide. Okay, the program coordinators are people who are in charge of programs, which is quite logical, isn't it? So basically, they are appointed by the IFMSA Executive Board in September, and they start working by the beginning of October, 1st of October, same as the TO. Of course, they are not just appointed by the EB. The EB takes into consideration the relevant team of officials member. So for SCOF related program, it's me and Skander Safi who will be right after me. So what program coordinators should do? Like, they should educate members of NMOs on how to enroll their activities under program. They should enable and facilitate communication between similar activities and NMOs, organize international capacity building activities with support of NMOs and IFMSA team officials, and work with relevant standing committee director and liaison officer on creating new opportunities. And all of that aims to achieve the goal and objectives of the program. They should also measure impact of NMO's activities enroll under this program by creating a program impact report. We'll discuss this a bit later. Moving on, we wanted to share the annual cycle of programs. We already discussed it a bit, but it's really beneficial for you to have it written down. So basically in September, we shared a call for program coordinators. This time around, we shared all 17 of them, but after the March meeting, we only shared 7 of those that we adapted at the March meeting. And in the future, if we adapt any news programs during March meeting, the call will be sent after March meeting or after every relevant meeting where the programs are adapted. By the October 1st, the program coordinators start working. During March, they represent the program during the GA, meaning what has been done within that program up to the March meeting. In June, they analyze all enrolled activities between July and the previous term until June. By the July 1st, they have to submit the annual impact report, and we'll talk about it a bit later. And August, they again represent the program during the GEA, and they present the impact report. And by the September 30th, as same as TO, it's the end of their term. Yeah, it's very important to say that activities can be enrolled throughout the term, meaning that we will talk about the mechanism later, but it's very important to have in mind that whenever your activity is, you have a chance to enroll it into the relevant program. So baseline assessment, and I use this funny picture because it sounds really complicated, but it's actually quite simple, isn't it? Basically, baseline assessment is a study that's conducted at the beginning of the program. Basically, why do we need this baseline assessment? Because we have to know the starting point. We have to know if the implementation of program actually benefited the federation, meaning that we have a starting point for, let's say, healthy lifestyles, and we knew we have these many activities, and let's say we have that amount of impact. So we want to know that after a year or after 2 years, we made a significant improvement. Currently, there's a is it currently? Petar, Petar, you correct me if I'm wrong, but there is a baseline assessment currently ongoing for the programs adapted at the August meeting, which is 10 of them. And you can find the link to assess the form for baseline assessment at the ifmsa.org and in your emails. because we all share them, because it's very important for us. And it's important for us because moving from transnational projects where we could never assess the impact and improvement to program, this is like the starting point. So we want to know how we improved over the years. It also serves to determine where IFMSA stands at the beginning, both with internal and external capacity and resources. This means that we assess internal capacity within IFMSA and our NMOs, and external capacity and opportunities, as well as weaknesses of both of them. The main benefits of the having program baseline are actually ability to access performance at previously set checkpoints, statistical analysis of impact that can be proven, and it actually points out the strengths and weaknesses that enable improvement to the next stages. You can find a baseline assessment for 7 programs that were adopted at the March meeting at ifmsa.org, and I would actually suggest you to take a look at them because you'll have a very good overview of where IFMSA stands with activities and like topics that relate to a program. Let's move on. So the next slide that we have is program impact report. So basically, that's an annual report that measures the impact of IFMSA and our NMO's activities during that year. It does contain that baseline assessment in the case of the first term of IFMSA program, meaning that for this year, it will be for the programs adapted at the August meeting, while for the last term, it was for the programs adapted during March meeting. The program impact assessment, it reviews the activity and showcases the impact that IFMSA program has made. And this is exactly what we want. We want to see the impact that IFMSA had made with the certain program. And also it includes steps that we will follow to improve our impact and improve the program in general. The deadline for IFMSA program impact report is the 1st of July, which will be in jurisdiction of program coordinators and a lovely BPA. And it has to be approved by the IFMSA General Assembly, which is very important because you as NMOs and you as members voted for programs. So it's very important for you to approve their continuous working. It will be shared publicly with our page, but also with our externals, so everybody knows how our programs are working. Next, it's a very important. Thanks. Next, we have a very important thing, and that's activities enrollment cycle. And I think for general members, this is the thing that they are mostly interested in. And that's how you can apply to a program. So if you have an activity and you already know you have an activity, you can apply to the program 4 weeks before the activity starts. And of course, this is problematic sometimes because we think of activities only. For me, sometimes I think week in advance when I was LPO and NPO assistant. But however, this will make you think about activities before and it will help you to be more sustainable. So how do you actually enroll? So 4 weeks before the activity starts, you submit 2 documents to the program coordinators relevant to the activities. Let's take NTDs and Healthy Lifestyles program, and we had World Diabetes Day. So 4 weeks before the World Diabetes Day, you knew you had a activity for that specific day, and you would enroll that activity in Healthy Lifestyles and NTDs program. First thing you would have to do is fill the enrollment form, which is a Google form created by activity coordinators. He or she explains the activity, and you have activity coordinator has to explain activity, plan of action, objective, and indicators of success, so that the program coordinator can actually decide if the activities belongs to this program. One of the responsibilities of the program coordinators is actually to spread awareness on how to enroll an activity in that form. Therefore, if you have any misunderstanding or if you have any concern, don't ever hesitate to contact program coordinators on their relevant email addresses, and you will find all of those on ifmsa.org, but also at the beginning of this presentation. The second document that needs to be sent is candidature form, which is a typical IFMSA candidature form to be stamped and signed by the NMO president. And why is this important? It's important because we want to ensure that the activity is supported by the NMO. Because if we had random activities applying to a program, it would be sort of a chaos. So it's important for presidents and for us to know that it's supported by the NMO. The next step, and it's one of the most important one, is after the activity has been completed. So after the activity has been completed, 4 weeks after it ends, you have to submit the activity coordinator or the person in charge of that activity in your country has to fulfill the report form, which is also provided by Google Forms by the program coordinator and VPA. This will actually provide us with the statistical data and evaluation, meaning that we will have numbers to back up our program. In any case, this is a very crucial part because only with those numbers and only with evaluation, we can actually see if our activities have impact. And this is actually the idea behind programs. So when you enroll, don't forget to submit the report form because it's a crucial step in the process. In the next few weeks, the enrollment forms for all programs will become available at IFMSA website, and I strongly encourage you to seek for them and to apply your activities. And for the last part is capacity related to the programs, is that programs contribute to building capacity of NMOs in actually couple of ways. They are creating manuals and toolkits, and it's something that we as standing committee directors are involving them to work on content. They are educating NMOs and their activities in coordination on how to plan activity, and also to set smart goals and objectives, monitor and evaluate success of the certain activity. They also help to organize international workshops during IFMSA meetings, general assemblies, pre-GA, regional meetings, pre-regional meeting, and sub-regional trainings that pertain to their topic. They will also have in this year short sessions regarding program and program implementation during, I think, most of the standing committees time, and we already had those during African regional meeting, and we as standing committee directors are really looking forward to presenting you the programs, because we know for our members it's very important to understand them thoroughly and completely. Well, one last reminder from me, please don't forget to ask questions. You can ask them by Twitter, Facebook, comment section of the webinar, and the replies will be provided by the end of webinar or after it if we don't manage to answer all of them. And now I would like to introduce my predecessor. So it's weird him coming after me, isn't it? So it's our liaison officer for public health, Skander Safi. Thank you.
Such a suspense, giving my name at the end. Well, thank you very much. Hello, everyone. I'm really happy to be part of the webinar, and I hope that I will provide you a part that would be really necessary for you to understand, which is basically how the programs have been implemented and what are we really looking for in the future. And we're really counting on your involvement, but also your feedback on the way to proceed. So I don't have all the fun images that Yoza has put, but yeah, pretty much like those slides cover everything, and I guess that it will be shared online. So basically, the way I will proceed is on a chronological way to cover what has been done so far, especially that when the program structure was adopted and when we removed the project structure as a way to unite all the activities that we are doing locally, nationally, and internationally under the patronage of programs. So this is the main vision that is also sort of going in the same line as the strategic plan that we adopted back in the August meeting 2014, where it has major strategic goals. One of them was to reorganize the way we are sort of gathering or overviewing the activities under the programs. And so the adoption of the system included the timeline where we wanted to achieve those things, and we're currently implementing them, but also evaluating like the successes, but also the shortcomings where we would like to sort of overcome them. So just to cover a little bit, but what happened between August meeting 2014 in Taiwan and August meeting 2015 in Macedonia. So since the August meeting 2014, we had a set of program proposals that were adopted in the March meeting 2015, and the number of 7, as you also mentioned, and 10 in the August meeting 2015. And right after the March meeting 2015, the executive board appointed interim program coordinators, just because of the fact that they had only a mandate of 6 months to work on the baseline assessment that he also explained very well, and that we wanted to become sort of effective in the next term, but it was also their mandate to submit a program annual report that was adopted by NMOs during the August meeting in Macedonia. So afterwards, as I mentioned, the 7 programs that were adopted in March meeting in Turkey were completely, fully functional in order to start being implemented, and they were working more on content related topics. So they're working on enrolling in new NMO activities under the relevant programs and building the capacity of the federation and the NMOs on those relevant topics. So, for example, we have for SCOF, as you also mentioned, we have the one on NCDs and healthy lifestyles. We also have programs that are related to other standing committees. And the process was defined so that in collaboration with the standing committee directors, after the 1st of October, where the new program coordinators have been appointed, this collaboration would lead to create an annual working plan for the term, so that they would have a really concrete steps to achieve. And those program coordinators are also working with the vice president for activities, Petar, in order to establish the system for enrollment of new activities. And we're getting almost there, so stay tuned for the actual link that will be provided on the website. On the other hand, the 10 other programs that have just been adopted in Macedonia in the August meeting 2015 are currently conducting their baseline assessment of those programs. And just a reminder that the baseline assessment is consisting of a review of a lot of reports and relevant documents that are consisting of the activities of the NMOs that are basically covered in the reports that are submitted before each general assemblies. So they cover what are the major projects that have been conducted, but also the activities, or the applications for the activities fair and the Rex Crossley Awards contest during the general assemblies that we have, and any official document that has been adopted by the general assemblies, including the policy statements that are also relevant to the priorities that we consider really important. So we are expecting the baseline assessments to be completed by January 2016, so that we can move forward with more sort of practical ways and having fully functional programs. So afterwards, we are expecting to work on to finish the annual working plan. That is sort of all of the programs are expected to be linked on how these programs will be effective in terms of capacity building, research, and advocacy. And we are expecting the activity enrollment system to be incorporated within the IFMSA.org website, so that it's available for everyone, for NMOs, for our external partners, since we are showing how much we are giving, we are reviewing the way we are working, and we also want some visibility out of all of the impact reports and assessments we are doing. It's important also to know that the current term is crucial for the proper implementation of both the program structure and programs adopted in the March meeting 2015 and the August meeting 2015, since it's the first step that needs to be really undertaken with precaution in order to really learn from the lessons we are going through. Until the end of this term, it will take a lot of efforts for both NMOs and us, the team of officials and the program coordinators, to ensure that the work is organized properly and according to our expectations, and we hope that we won't have any unforeseen issue. And we're trying to evaluate the whole process and try to give recommendations for the next team of officials, the next program coordinators, so that the process of transition can be as smooth as possible, and it will like really push for the programs to be more effective. And in the future terms, we hopefully next term we'll be having a fully functional programs and program coordinators, and we're so much waiting for this moment, because we are still in a phase of evaluation, and the moment where we'll have all of the activities to be enrolled, and trying to see the impact assessment and the whole impact that we're having as a federation on our medical students and on our target groups. This will be a really good achievement that we're hopefully going to. And so the work will be concentrated on implementing changes in order to evaluate what has happened in the past, whether it's to submit for new programs where we believe that there will be new topics that are not tackled, or to expect to see changes in the current programs based on the lessons that we will learn, and we are actually and continuously learning. So I think this my part comes to an end. If you have any question, as you also said, if you want to post it on Facebook, on Twitter, on the Q&A section of the webinar, we'll be happy to respond accordingly. And I'm really happy to introduce my colleague, Marie. It's really hard to pronounce her surname, but you can say it instead of me. Liaison officer for WHO. And yeah, thank you.
Yeah, so I'm Marie Hauerslev in Danish. And I'm the liaison officer to the WHO, and this means that I'm working with external representation of the IFMSA, as well as I've previously been involved in the adoption of the programs, etc. So I'm going to present to you some of the benefits for IFMSA and the NMOs of implementing this new program structure. And one of the main benefits is that with this system, we aim to have sort of meaningful collaboration between the NMOs, where the NMOs will benefit from working with each other in a way that will actually have an impact. Okay. Furthermore, the program coordinator will be there to support the activities, and this means that there is an IFMSA body that is taking care of the content that the activities will be working on as well. So there is support here. And furthermore, the activities that are enrolled in the IFMSA programs will be able to use the logo of IFMSA, which can be beneficial in many purposes, such as fundraising and promotion in other ways. Furthermore, about the program impact report, as previously mentioned, all the enrolled activities will be presented in this impact report, and it will be summarizing the impacts of each program in a sort of a statistical manner, where the specific topics of each program will be mentioned, as well as what activities of the NMOs have each of them. Right. And this program impact report will be a tool that we will be able to use to increase the visibility of IFMSA. We can increase the visibility of the NMOs themselves, as well as the activities that are enrolled in the program. And the ways that we see this is that it can be used if you have to introduce your NMO or your activity or IFMSA in some situation. You can say that, hey, we have this program, and in this program we actually had a huge impact on awareness about some public health or global health field. So there will be a lot of different ways that we can imagine that it could be useful to have this impact report. Furthermore, they can use the statistics. All of us, we can use these statistics for fundraising purposes as well. Right. And then going a bit into external representation, this collaboration, which is now we have sort of a structure in IFMSA where we have a link between the local, the national, the international level, and the advocacy, the external level. And this means that if I'm going to, or me or Skander are going to a conference that is about NCDs, we can actually have a look at the activities and the programs, and we can talk with the program coordinators. And here we can have a direct link between the work on the ground, where we actually have a real impact. I mean, in the activities at the local level, this is where we have an impact, right? And we can take this to the international, the global advocacy, external representation level, and present it to our partners and use this as a tool to have a higher impact at that level as well. And hopefully, the impact that we may have at the external representation level could then as well feed into being giving more purpose and maybe more visibility of the programs and the activities that are enrolled in the programs themselves. Right, so that's seeing from each of our benefits, but as well for IFMSA, it can have a benefit that we have a closer link between the activities, the projects, the campaigns, and the external part. So for ourselves, it's also a way of creating sort of unity in our federation. Furthermore, it can strengthen the members with capacity, and the capacity building of members in the different fields could also make members better. Thank you, Skander. Could also make the members better representatives of IFMSA. So if we go to this NCD conference with someone that has been enrolled in the program or active in the program, they can actually represent IFMSA better at the external level in the end, because they have worked with it and they have knowledge about the topic. And this also means that there can be a natural development path for individuals within IFMSA, both within the local, the national, and then moving on to sort of the external representation level. So that is also an opportunity. And then, as I said, we could actually have, I really believe that we can have a higher impact at the external level if we use the programs. Furthermore, about the activities database, which is a place where all the activities that are enrolled in the programs are going to be presented. This will be a source of information for NMOs on which activities there are, and that could be both sort of an information tool, a place that people can look for out of curiosity, both for potential partners to collaborate with if you have an activity within the same program or another linked activity in some way. But it could also be a source of ideas and developing new activities within your NMO. Furthermore, it will increase the visibility of all enrolled activities, and it could facilitate the communication with externals if there's something that's specifically relevant to that activity. And just to say a bit about the process, that the collection of activities will start after the completion of the baseline assessment of each program. Regarding capacity building, there are also some, I guess, kind of obvious benefits for both IFMSA and the NMOs. So as Jozo mentioned, I think, that the capacity building activities of in the Federation and in the NMOs will be easier to organize and might become of a higher quality, because the people will have general really good knowledge about the things or the topics. We could, there's plans to develop training toolkits, to have sessions and workshops and meetings about the different areas that the programs are working on. And as well, there will be potential to find external partners that work within these fields, as I mentioned before. And then we also have sort of a direct relevance between the externals that we're inviting and the program and the people that are working within the program at the meeting. And then finally, which is also a really important point, this will be building a community of medical students that are equipped with the knowledge and skills about one specific topic, so they will be experts, right? Right, and now I'm gonna remind you that you can still ask questions at all of the sort of platforms that we have in IFMSA. And I'd like to introduce Carlos Peritas from IX Catalonia, who is, well, most of all, he is actually our Scora director.
Okay, thank you for the applause. And the perfect pronunciation of my name. As Marie was talking, there are lots of benefits when it comes to the implementation of the programs, but there are also obstacles and barriers that we need to overcome in order to achieve those benefits. So I'm just gonna try to list them down and explain a bit all of them in a really comprehensive and simple way. I'm not gonna extend that much as they did, because I think that these should be kept like somehow cute and simple. So, for instance, the first problem that we face is the number of programs. When the program implementation small working group started working, it actually recommended that a total amount of 20 programs should be the maximum that we could allow ourselves to have, just for the sake of sustainability and implementation of set programs. Currently, we have 17 programs, and we are trying to implement them all at once, which is a major challenge. Therefore, the TO, who is the one responsible of this process, needs to work hard to ensure that these programs are implemented properly, and also needs to be mindful about the number of programs that are like proposed or that are like likely to be approved. Otherwise, we will like kind of lose track of this implementation and may feel that it gets out of hand. Just like the meme in my PowerPoint presentation, in which everyone and we need to avoid a situation in which everyone and each specific subject gets a program. Otherwise, we will lose track of the implementation. So the second issue that I've faced like a lot as a standing committee director, and last year when the implementation started as a national officer, is the overlapping programs. There are lots of programs that have overlapping objectives, overlapping content, and overlapping activities that can be involved into both. For instance, just to put an example in the Scora context, if you have an activity that is about peer education in schools, about how to prevent HIV, where should we enroll that activity? In the comprehensive sexuality education program or in the HIV and STIs program? So therefore, the program coordinators, with the help of PETAR and also like some members of the TO, have been trying to come up with a way in which the overlapping of the currently approved programs is not such big of an issue. And we are trying to implement that strategy, in which we decided that activities can be enrolled up to like 2 programs, but always like trying to be mindful and trying to find the correct perspectives to see which one fits better the activity. And also we try to like pass the thought that we need to be mindful when it comes to proposing programs, and try to avoid proposing programs that are overlapping with other existing ones or other proposed ones. So the next, the third current challenge is the capacity of the program coordinators. As I mentioned, it's a really new process, and therefore the current program coordinators are still in a learning process in which they don't know all their functions perfectly. They are learning on the way, and therefore we need to give them the support and be there for everything that they need to ensure that their jobs are done properly. This is not something that can be created overnight. Of course, we need to go hand by hand and try to I'm going to be metaphorical and go through this journey all together and try to find the best way to ensure that the program coordinators have the best capacity building possible in regards of programs. Sorry. And well, the issue is related to the fact, as I said, that the program coordinators need to have a specific set of skills, and which those skills are expected to be developed in the meantime during the implementation of the process. There's a necessity to ensure sufficient time for program coordinators to be trained and for them to create the basis of the relevant program. And therefore, like the last challenge, the last barrier that we need to overcome in order to get the benefits that Marie was talking about when it comes to programs is the evaluation. This is a new process, as we were saying. This is something that we're currently implementing, and therefore we haven't like actually evaluated it properly. We haven't really evaluated if the program structure is something that will work or will not work. And it all depends not only in the team of officials, which are like the ones, as per se, in charge of chasing down the dream of the program's implementation. Sorry, and ensuring that the programs are properly implemented. But we also need your help. We need the animals' help. We need to make sure that that we get your input, that we get your evaluation, and that we understand what your needs are to ensure that the implementation is pushed forward properly, and also that it is done in a way that works for you, especially for the animals. So for me, this section would be the last one when it comes to barriers and obstacles. I would say that as a summary, that a city can't be built in a day, and properly realizing the creation of the adaptive programs will require incredible efforts from both sides, not only us, but also like animals. We know that it's not an easy process, that it may take a while to get used to the new structure, but the team of officials, the program coordinators, and the AV are here for you for anything that you may need in regards to this subject. And as all my colleagues mentioned previously, don't hesitate on asking all the questions that you want through the Q&A, to Twitter, or comments on the webinar event. And that's all from my side. I'm gonna leave the floor to Petar so he can conclude the webinar. And
I have 2 questions.
Okay, we can do that at the end. Okay, hello again. So I would just like to summarize a little bit about everything that the other people said just now. So first of all, don't forget, ask any question that you might have. We're here to respond to them and to make sure that you understand everything there is to know about programs. So as an overview, programs aim to measure the impact. Programs aim to measure the impact which the activities of animals and IFMSA have on the local, national, and international societies. In support of this goal, the programs work on capacity building activities in supporting you. Program coordinators are the individuals who work to execute the aims of the relevant program. The baseline assessment allows us to see where you and IFMSA starts from and when taking a new initiative in the face of a new program. The impact reports measure the impact that we have had in the previous period between the baseline assessment and the next impact report. The enrolling of activities follows the 4 simple steps. Number 1, submitting an enrollment form. Number 2, getting approved and having your activity enrolled under the program. Then sending your report back to the program coordinator after the activity has been completed. And finally, making a difference. Programs allow animals to collaborate with each other, to learn from each other, to improve your activities, and to affect the world in a positive manner. Programs will only work if we all put our efforts into making them work properly. The webinar video, the presentation, and a toolkit on programs are going to be shared with your organization. Therefore, make sure to ask for them. Finally, make sure to complete the evaluation form, which you can find in the link, and help us improve the information that we're providing with. I would like to thank all of you who are attending this webinar, and as well as all the people who are helping us execute it properly. And that would be it. Have a good evening. I'm sorry. I knew it. So we're just going to go through the Q&A section. Can I see the question?
Yeah, we can.
We will read it for you.
Okay, so we're going to have the questions right now.
Okay, one me, one.
I can. Okay. So the first question is from Laura Kalkman from IFMSA NL,
Hey.
and the question is, what if the activity takes place whole year around during the whole academic year? what would then be the deadline to apply? For example, giving sexual education lessons to children.
Then you should be able to designate specific periods of that activity within, at the end of which you're going to evaluate whether or not your activity was a success. At the end of that, you're going to be able to report back this activity to us. So you should be able to separate the activity into smaller parts. That would be as a summary of that question.
Okay, and then we have Vilda Skylstad
Norway.
No way.
from
Norway.
Elements in Norway, and she says, "I'm a bit confused about the lifetime of an activity within a program. They apply 4 weeks before startup and are a part of the program until the specific activity ends. When is networking between common activities, capacity building throughout to take place?"
The networking between different activities is going to be a task which the program coordinators are going to start working on in the next period by contacting the activities which are already enrolled under a specific program after the activity has been completed, so that they can improve their collaboration in the next time that they're organizing a similar activity. That would be the answer to that.
Yeah. So the next one is this meant to be for the activities of our project? As Lara says, the project usually go on continuously, but have various activities such as debate, etc. Is it the specific activity of the project that should apply to be part of the program?
Okay, this is a very complex question, and we're going to make sure to go through it. Unfortunately, right now, we don't have that much time to go through all those details, but we're going to make sure to get back to you. We have all the questions, and we're going to make sure to include the Q&A section in the toolkit as well.
And we have a final question.
Okay.
So this question comes from Hussein. How and when will enrollment start? In addition, are all programs taken or only certain programs?
I didn't understand the second question. Could you?
In addition, are all programs taken or only certain programs? I
do not understand.
I believe it means can they apply to all programs or only to certain programs?
So currently, as Skander earlier mentioned, we currently have 7 programs who are already actively working to start the system of enrolling activities under that program. This should be initiated within the next few weeks. At the same time, the remaining 10 program coordinators are working to finalize the baseline assessments of their programs. And immediately afterwards, they're going to create a system with which you can enroll your own activity. By a system, I mean a Google form, which you can receive by the program coordinator and which you have to complete with the information on your activity. Okay.
And we have another question, which is from Naren Nalapeta from MSI India. And the question is there any possibility of getting any financial support for our activities?
Unfortunately, currently, no. But there's a big but here. In the future, this is definitely one of the goals of the overall idea of having our programs and the benefits that are going to come from the impact report. You as animals are going to be able to use the impact report as a way to fundraise for your own activities. In addition to that, IFMSA is going to continuously work to provide you with additional opportunities to further build your own capacity by providing with information provided by external partners of IFMSA. Okay, any other questions?
No,
We will come say bye.
we'll come
Okay,
back.
so we have everyone just say bye. If anybody wants to say any kind of words, but thank you all for participating and see you until next time.
Happy New Year!
Happy New Year!